pitch as well, too, I think are the two.
That would be correct.
I think are the two things. Well, let's get started with the questions. This is from Janelle in New Orleans, and she says, why isn't it mandatory that every citizen of Louisiana wear a mask like they did in China? And should you not be able to go in the store without a mask on, which you and I aren't wearing a mask, so.
Well, it would be very hard to communicate with it. I think if you're practicing social distancing and you are very cognizant of what you're doing, there's times where I think it's okay. But we're not at the point where the CDC has said that everyone should wear a mask. They keep saying that we may get to the point where everyone should wear a mask. Mm-hmm. I think it is advisable. I think it is good practice when you go into places with large populations of people, like grocery stores and other places where you don't control your environment. But for the most part, we're not there yet, and I don't anticipate us getting there yet. Testing is far more important, or just as important as the mask.
Yeah. This is from William in New Orleans. He says, how are you working in Congress to expand access to ballot via mail without compromising critical in-person voting opportunities, which are important to protect the voting rights of certain insecure and disabled populations?
I think that if I could wave a magic wand and tell Congress exactly how to do it, and it's what I'm advocating for, and that is to expand early voting. In Louisiana, we have early voting, and we have it for an entire week. We also have mail voting for specific populations. I think we ought to take that mail voting that we do for our seniors and for our military and expand it to the general population. Now, I would not want to, but if part of the compromise was that we only do it to those populations that the CDC recommends not to come out in public, I probably could live with it. But I think that we have to keep in-person voting. The question is, do you extend the time of in-person voting so that you can have the social distancing without having to cram it within a 10 or 12-hour time frame? Maybe it's 2 days as opposed to 1 day, but we have to make sure that everybody who wants to vote, especially in a time where the future of the country is so important, that they have the ability to do it.
Yeah. Did you follow the vote in Baton Rouge? And I guess there's another meeting tomorrow in Baton Rouge again to try to reach a deal on that?
I did, and unfortunately in Louisiana, we are still stuck in a state of silliness where partisanship rules the day. And so it was a party line vote. All the Republicans voted no. The sole Democrat voted yes. When in Louisiana, we do a mail voting program, and we've been doing it for a while. We've had not one instance of voter fraud, and that's just the excuse they use. And the truth of the matter is the people you're disenfranchising are vulnerable, they're older, they're not necessarily black, they're not necessarily white, they're not necessarily rich or poor. But why? The whole premise of democracy is getting as many people involved in it as possible.
Okay. Gerald from Baton Rouge says, how soon before antibody testing begins, and will it be free of charge?
They're doing antibody testing right now.
Okay.
And so there's only one, I believe, that has been approved by the FDA so far. But there are a bunch of private companies that are now doing the antibody test. And at some point, it is going to be a very critical part of recovery along with regular testing. And as I understand it right now, they are free of charge. But if government is not going to pay for it for the future, somebody is. And since we have not expanded health care, it may be the person getting tested.
Oh, or the employer.
Or the employer.
Or something like that. This is from Adjuan of Harvey. This is from Daniel of New Orleans, who says, why do we get health insurance through our jobs or our spouses' jobs when employers, marriages, divorces, widowhood are so unpredictable? Why not just guarantee health insurance for all like other countries do?
Well, this has been a very robust debate since this started. And I believe Italy, for example, has Medicare for all. And we saw how their response to COVID was, and we saw the deaths, and we saw the, just the chaos there. So just saying universal health care is the answer is not all the way true. However, I believe that's exactly why you have to improve upon Affordable Care Act, Obamacare, add a public option to it, and that anyone who loses their job should automatically be able to sign into the public option or Obamacare. And the plan that the party has arrived on now is that you can sign up for it. If you don't make enough, then you're automatically enrolled, and it's free. And so that is the goal, but I will tell you that the fact that we did not reopen enrollment period for health care right now, when so many people lost their jobs and lost their health care, I think that was an unfortunate misstep on Congress's.
Okay. Explain that a little more, what the proposal was and what happened to it,
Well,
and what it would have done.
What we wanted to do, and every year you have a sign-up period for the Affordable Care Act, Obamacare.
Yeah, it's like
And
in the fall or something.
right,
like
it's
that, yeah.
closer to the end of the year,
Okay,
and
yeah.
you sign up for health care through the federal government, through the exchanges.
Okay.
And what Democrats argued was that since we are now having mass layoffs and we have unemployment that we've never seen before, when people lose their job, they also lose their health care. And so our message was, since we have 60 million or so people now unemployed, why won't we reopen it so that they can contribute into the system and get medical care? And there was just a real hard resistance from this administration to do that.
So was it always true? I thought one of the features of the way Obamacare worked was that the enrollment period was the enrollment period, but there were certain allowances for life-changing events or whatever they were called, which would be divorces or whatever, and that you could enroll, you had special dispensation because of those life-changing events. Did that not cover this?
There were certain triggers, but I don't think unemployment's one of them.
Oh, really? Okay, that's interesting. This is from Kendra in New Orleans. Do you think real estate taxes in cities in Louisiana, especially New Orleans, will be postponed?
It's a local decision. The short answer is I don't. If the federal government does not step in to help these cities and local governments and states with funding. And so we saw that after the Great Recession, even after Katrina, that the federal government put budget stabilization money into states so that they could keep operating essential services because we're losing tax revenue. So New Orleans, based on tourism, there's very little tourism, so at some point they're going to run out of money in the bank account.
Yeah.
And if they do that, they can't then exacerbate that by waiving tax
Taxes,
collection.
right.
So
Yeah.
that's why I say I doubt it, but that's why it's incumbent upon the federal government to give budget stabilization money to cities.
Yeah. Is New Orleans and Louisiana going to be worse off in the recovery because we're so dependent on oil and tourism, and those don't seem like industries that are just going to bounce back?
I've seen several studies that said it's going to be more challenging for us.
Yeah.
And let's just assume overnight we get our workers back and our restaurants open. The real fear and the real concern that we see is that people are not going to be willing to travel.
Yeah.
People will not be as willing to sit in a restaurant. And so we think that it's going to take time. Now, I would hope that the projections of 2 and 3 years are incorrect. I hope it's more like 2 or 3 months. But I am fearful that it's going to take us a while.
Well, the mayor announced that she supported canceling, all of the postponed big tourism events, and they canceled. And there's a little community debate about that, although one thing she said was that they wanted to cancel, and I think if you try to envision it from their point of view, maybe they would have put on these events and they would have had some disappointing crowds. But what's your view of that?
I think it was the right call by the mayor, and I'll just tell you, as a person who's responsible for putting on a big event, we do a Congressional Black Caucus annual legislative event that brings in tens of thousands of people to Washington, D.C. We're now looking at doing it virtually. And the part is, and I think a lot of people don't understand or recognize, is the fact that the contracts are signed months in advance. And then you have triggers closer you get to the event for non-refundable deposits and things like that.
Yeah.
And right now, if you're going to make the wise decision, it is to figure out a way to do it virtually, figure out a way to be more creative and not anticipate that you're going to be able to assemble mass crowds immediately. And so Mayor Cantrell, who I think has been doing a good job with this pandemic, had a decision to make, and I think that she made the right one.
Okay. But given the way conventions work with all that booking, that's actually probably bad in terms of depressing business going forward, because people aren't going to be confident booking 2021, 2022 events. Is that a problem?
Well, no, I don't think so. I think people are going to look at it the opposite way, actually. I think that you're going to see other places open up too soon, and you're going to see spikes come back. And I think that if we do it right, you will see us heal as a community better than other communities, and we will be safer to come to.
Okay.
But those, and our tourism industry has to admit that we have an active tourism season, and then we have a season where it kind of slows down. Voodoo Fest kind of saves the fall area. Essence Fest saves the summer area. But both of those already announced they weren't coming. So I think that her decision was a good one.
Okay. Jeff of New Orleans asks if you're going to support the Boost for Communities Act.
I don't know it by name. I would hope.
It's from Representative Tlaib. Okay. It doesn't ring a bell.
Doesn't
okay.
ring a bell
Okay.
without a further description,
Okay.
but maybe as we sit there, I'll Google it.
Okay. Brenda from Harvey asks, what are you doing to expedite the release of nonviolent prisoners in jails and prisons where coronavirus exists or is a threat to exist?
We have, of course, talked to the governor, the Secretary of Corrections in Louisiana about that. We wrote a letter to the Federal Bureau of Prisons asking them to release people out of the halfway house and close them, because not only is the inmate within 6 months of going home anyway, we're making people show up to work every day in an environment that may not be well suited for them. So we got a little traction there. They started releasing people, and in fact, now we've expanded it to the prison camps, which many of the prison camps don't have fences or walls around them anyway. They're little communities. And so it looks like at first they were going to release everybody. Now it looks like they're somewhere around 50%. So we're going to keep pushing, especially those nonviolent offenders that are close to a release date. It just doesn't make sense to continue to put everybody in harm's way.
Yeah, and Jillian of New Orleans asks, sort of relatedly, there are large numbers of immigrants in detention facilities in Louisiana, including the one in Oakdale, which I think has a lot of coronavirus. And what's your view of what should be done with that, and what are you doing about that?
I think it should be handled the exact same way, especially if they have a U.S. residence and person where they would be going, and we would be able to contact them, and or we release them until they have if their only offense is being a non-resident citizen, right? If that's their only crime, then that's on the books. Then I think what you have to do is release them, give them a court date, because I don't think that we ought to pick between which nonviolent offenders, and I think that some of our corrections places here went over and above to solicit ICE prisoners. So we just need to make sure that we write that.
Yeah. Cindy of Laplace asks when the unemployment office will catch up.
I think
I know you don't run the unemployment office.
I don't, but considering that we sent the money out, it was important for us to push them to get it right, and I think that they are almost caught up. I will say one thing. We were one of 2 states to get it done very, very quickly. So the problem was that the feds waited a long time to get the money. The state had a whole bunch of processing to do, and when you start talking about, I think we're at, you know what, I won't say the number because I'm not sure that I'm right, but I'm told that we're in the process of catching up, and it should be within, days, not necessarily weeks.
Oh, are you hearing that I know one of the issues was inability of people to get on and apply because the website was jammed up or something, and the governor was saying you got to do it in the middle of the night, which, it's not what voters want to hear.
Well, the website was one thing. The telephone communication was another thing, and I think that they have fixed all those problems. Ava Dejois, our Secretary of Labor, has been working nonstop to make sure that we can get those funds to people because it is necessary. The good news is that the administration finally took the push that we made to make it retroactive from your date of unemployment.
Oh, is that right? Meaning
The benefits.
the federal, or when you
Federal.
say the administration, you mean?
Federal administration.
Okay. So what would happen if, for example, I had been laid off before the coronavirus crisis? In other words, I was already on unemployment. I mean, what am I eligible for under those circumstances?
Some people who may not be eligible for regular state unemployment may be eligible for the enhanced $600. So that's why we told everybody, even if you had been denied unemployment, to apply again, because you may now qualify. And the theory behind it, and I know, look, we've tossed this around a million times within think tanks. The theory behind it is to try to keep people as whole as we can, try to keep money in commerce, because these people who are the people who receive unemployment, they're not putting it in a savings account or investing it. It's going smack dab right back into the economy and to businesses and all of those things. So between PPP, the disaster loan, and unemployment, it is our best ability to put money in the hands of working people and keep the economy going all at one time.
Susan of Metairie asks, what will you be doing to stop Trump from doing away with the U.S. Postal Service? I wasn't aware he was doing away with the U.S. Postal Service, but maybe you know something I don't know.
He has an absolute disdain for the United States Postal
does he?
Service.
Okay.
And in the first CARES Act, they blocked money that would go to the Postal Service to shore them up. And we treat the Postal Service different in a number of respects. They have to pre-fund their pensions and some other things that put them at a competitive disadvantage. But those are frontline workers working every day to deliver mail. And now mail is very important to a lot of people, especially people who have to receive their stimulus check through the mail. We know how important it is. And if we start doing voting by mail, it's going to be essential. And so we want to make sure that we shore it up, put it on sound financial footing, and we're getting blocked every day by Republicans.
Oh, is that because of the post office runs deficits, or is it because the post office might facilitate, in your view, might facilitate voting by mail, or?
I'm not sure. The president's disdain came after the post office reached an agreement with Amazon to deliver a bunch of Amazon products.
Yeah,
But
okay.
they do that at a profit, and they're going house to house anyway. So it was a win-win for both of them.
Okay. So Karen from New Orleans says that the PPE program was depleted by large corporations, getting too much money, I guess because they had better bankers or they were deft or whatever. And are we just signing up for a second round of the same thing?
The short answer is no, which is why, and I want to correct those numbers.
Okay.
$250 million will go into the program just like it was.
Yeah.
$60 billion. Then $60 billion will go into a set aside for small businesses, although they will still be eligible in that first portion. Big banks, don't know how, don't know why, I'm not a part of the administration, they somehow seem to have the rules and the procedures before a lot of smaller banks. And so their applications were
That's interesting.
submittal ready almost immediately. And that sucked up a lot. And then, unfortunately, we saw some examples of some corporate entities that went in and sucked up the maximum amount, which is $10 million. Potbelly collected $10 million.
Yeah.
Shake Shack collected $10 million.
Yeah.
But Shake Shack, when they saw that it ran out of money and so many small businesses were still in line, Shake Shack returned their $10 million.
I saw that.
And then you saw Ruth Chris, somehow, some way, our old steakhouse headquartered in New Orleans, but is now headquartered in Florida because after the storm, they went to Florida and didn't come back. They split into two entities and collected $20 million. So we're going to make sure that that doesn't happen. But the overwhelming majority of the loans were to small and medium-sized businesses.
Okay. Dawn of New Orleans says that she's a small business owner paying off an SBA loan from Hurricane Katrina. And this comes up, this is a theme in the questions, is forgiveness of those loans in the cards?
Up until this pandemic, I would have said no, because we would have to figure out a way to pay for them. And since I've been in Congress, I've advocated for that. And during the Obama administration, everything had to have a pay for. We were worried about the debt and the deficit. Under this administration, it appears that we're not so worried about the debt and the deficit. We passed a $1.5 trillion tax break without paying for it, and now we have this. And so I think that ideally we should forgive those old SBA loans. These are a little better than those old ones, but we did do forbearance and some other things. But you know, it is time to look at forgiving those again under new circumstances.
One thing that comes up in a few questions and has come up in the previous town halls is people saying, you know, who's paying for all these? You know, we'll put $350 billion more in that. We'll give $70 billion to this. How's that going to get paid for?
Right now, with the emergency spending, you don't have to have a pay for. We're absolutely not paying for it, and we're putting the money out there. And not only have we spent after this right at $2 trillion, but there's a lot more to come. I mean, when you start talking about jump-starting the economy when this is over, that's going to be another, could be $1 trillion. And you may get a CARES Act too, which, for example, these stimulus checks that go out, we did that in anticipation of government opening soon. If government doesn't open soon, then you may have another round of that. So it's going to be a lot of spending, and it's not paid for yet. But there are ways to pay for it. We could roll back some of the business tax cuts that we gave during that Trump and the Republicans gave out without paying for. Businesses never thought they'd get down to 21%. And so we could find a sweet spot in the middle and save money at the same time. So, you know, we'll cross that bridge when we get there, but hopefully we cross it sooner rather than later.
Yeah. What is the magnitude of the deficit going to be at the rate we're going?
By the time all of this over, it very well could be 25 trillion.
25 trillion?
In debt.
In total debt?
In total debt.
Okay.
Deficit-wise, I have no idea.
Okay.
Considering the fact that we are still spending every single day, and we're going to go up tomorrow and probably spend almost $400 billion. So.
Yeah. Okay. What happens? Ann of New Orleans says, "What happens if a stay-at-home order is in place and we have a major hurricane?"
Well, let's hope that that doesn't happen.
What else can go wrong?
Let's pray that that doesn't happen. If that happens, we will have to act accordingly. And if we get an evacuation order on top of a stay-at-home order, I think the evacuation order would trump it, and we would have to find ways to evacuate in the safest possible manner, and we may be at an all-mask, all-glove situation. I'm not sure.
Okay. Well, that's a frightening thought. Ann is a pessimist. Brenda of New Orleans says, "How could you vote to give yourself $8,952 a month raise?"
That's just not true.
Okay.
That's one of those things that someone will put it out there, and then it becomes reality. If we have a raise, I don't know about it. I did not vote to give myself a raise.
Okay.
We do not get, you know, lifetime health care and automatic pension from day one. So, but there's no
raise.
There's no raise, Ann.
Okay. I actually asked Congressman Scalise that, and he said the same thing. And he said there was money for some take-home computers so that staff members could
Right.
work at home and that
Well,
maybe,
for that, and to be technical, we use money left over from last year
Okay.
to allow each office to do telephone town halls that are expensive,
okay,
and to buy computer and equipment so their staffs can work from home to still fill constituent complaints and things of that nature. But that's the only enhancement we did, and we just used leftover money to do that.
okay. What happens, since we're on the subject, if a constituent calls your office, like, what, they get automatically routed to someone on your staff who's working at home? Is that how it works?
Absolutely. So if you call my district office, it goes directly to the district director. And if you call my Washington office, it goes to a person in New Orleans, because our priority was people in New Orleans, Baton Rouge, St. James, St. John, Assumption, all of our district. That was our priority. So the DC calls are routed to New Orleans, to a person in New Orleans, and the office in Gretna is routed to our staffer in Gretna. Baton Rouge is routed to the person in Baton Rouge. So a local person is going to answer, they're going to take the information, and then they're going to email it to the appropriate person. And we did that very early on to make sure people can always find someone to talk to.
Okay, is the call volume up? I assume the call volume is up.
The call volume is up, and it's really people looking for information. And so that's what we do a lot of. And a lot of these same questions, we have sheets so that whoever's answering can answer and not leave people out there without information.
Okay, Barbara of Convent says, how many coronavirus victims live near petrochemical plants?
We just, yesterday, the state just released COVID deaths by census tract. So I would imagine in the next 2 or 3 days, people will isolate chemical plants and those deaths around it by census tract. And you don't know where in the census tract, but it's pretty limited, so it'll give us a pretty good idea.
Yeah. Did the, this is this is my own question. Did the racial disparities surprise you? Which I guess it was a week ago that suddenly the statistics became available to see all that. Did that surprise you?
The 70% absolutely surprised me. And we've always said, as a black caucus and a black community, that if America catches a cold, the black community catches pneumonia, because everything's exacerbated in minority communities and poor communities and communities of color. So it didn't surprise me, but the number 70 did. And I always thought the number 70 would come back down as non-urban areas started to get their clusters, and I think now the number's at 56%.
Yeah, it is coming down.
But we're still only, African Americans are still only 32% of the state population, and that is an alarm. But I also think it's a wake-up call on a number of different areas in terms of why it may be the case. Stay-at-home orders, if you look at cashiers at grocery stores, if you look at cashiers at pharmacies, if you look at all of these places, you have an overwhelming number of minorities that are still going out to work. Then there were a number of minorities and African Americans who could not self-isolate as soon as everybody else. So when it became mandatory, that's one thing, but in the beginning it was a suggestion.
Right.
And the more affluent you were, the more you could afford to self-isolate.
Yeah.
And in too many communities, if both parents go to work and the child is off of school, virtual schooling, but at home, they have to go to work. They bring the child by the grandparents' house, which is, under these circumstances, last place you really want to bring them. So if you look at all of these community factors, and I'm not even talking about food deserts and banking deserts and insurance deserts and all of those things that add to the underlying chronic diseases, it didn't surprise me. But the 70 number,
Surprise you?
yes,
Yeah.
it was a wake-up call.
Is this, I just haven't followed this, would the same thing be true in Detroit or Cleveland, or, I mean, is
Yes.
Louisiana unique? Is it
No,
true?
Louisiana is not unique.
Is that true in New York?
Detroit has very high numbers.
Okay.
Pennsylvania, high numbers, but it is an alarming that African Americans consistently are above their percentage of the population that's dying of COVID.
Okay. So Mary of Gretna says, if the elderly at most at risk, why can't we test all who want to be tested?
Well, contrary to what's coming out of daily briefings, we still don't have enough tests, and that is the frustrating part. I was able to get Hyundai, the car company actually, they bought 10,000 tests for Louisiana for the 2nd Congressional District to help LSU Medical Center broaden their testing and to reach out more to underserved communities and do testing. But we need mobile testing. We need to really invest in testing, which is why we put another $25 billion in the testing.
Yeah. Okay. What's your connection to Hyundai? I mean, they don't have anything in this area disproportionate that I know of.
Just a relationship.
Okay.
They're, one of their influential people is on the board of the Congressional Black Caucus Foundation, which I'm the chairman of, and
Okay.
he reached out and said, how can we help? And so I even think they loaned LSU Medical Center some vehicles too, to make sure that they could get out to places and test. So if you look at St. John and you look at the river parishes and you look at, even New Orleans East or Jefferson Parish, West Bank, those are places where we need to get out and make sure we're testing.
Yeah. Well, he didn't give his first name, and I don't want to give his last name, but his question is, what is the plan to stop Trump from using the coronavirus press conferences as a campaign rally?
I have, on the campaign, we have looked at it, it's almost, there's a rule in campaigning, you're familiar with, equal time.
Yeah.
So if you give somebody time on TV or radio or print to spew a campaign message, you have to give the opponent the same amount of time. President Trump has taken a lot of his coronavirus time to campaign, but the truth is, I think American people see through it. The hardcore Trump supporter doesn't matter anyway, but I think a lot of people who are looking for real information, accurate information, I think they get turned off by the misinformation, the campaigning, the degrading of governors and public servants, and not just uniting the country in a pandemic, but dividing us further.
How do you, as a member of, do members of Congress get some special briefings on this, or do you have more information, access to more information than what you could just read online or read in the newspaper or see on TV?
We do. We have conference calls just about daily with different health experts that the Democratic caucus will bring in. And yesterday, the day before, we had the Deputy Director of Department of Health, of the CDC. We bring in some of our own experts to talk to us. So every couple of days, we're getting up-to-date information, and we work with the administration best we can to get accurate information, and the public servants within the administration are a lot more candid, a lot more accurate than we get from the head of that administration.
Okay. Patrick of New Orleans says, in response to the coronavirus crisis, will you be supporting the Health Care Emergency Guarantee Act? It's another one. I'm not sure I know what it is.
If it's another name for Medicare for All, no, I'm not a Medicare for All person. First of all, and I hate to take a moment to just go into it, but Medicare for All is not a plan that would pass within the next 4 or 5 years. Second, to full implementation is almost 10 years. And so we need something that can get us to almost universal health care coverage on day one. And I believe that adding a public option to Obamacare, mandating Medicaid expansion like Louisiana did that added 400-something thousand people to the rolls, I believe that's the way to go. And so that's the direction I believe we will be headed in. And just for the record, I think that those bills in the Senate may only have 6 or 7 co-authors. And how do you get to the 60 you need to defeat a filibuster and the 51 you need to pass it?
Yeah. Coy from Gramercy says, why isn't the Department of Defense in charge of controlling the supplies to the 50 states, which was once suggested by General Honore?
This administration, it was suggested not only by General Honore, which is a person I think has a lot of credibility, but we all know that the armed services and the Department of Defense, maybe on the procurement side, are not the best in terms of getting the lowest prices, but on the facilitation side and the delivery side, they do an amazing job of logistics, and that is something that we all pushed. I think that, and it would take the politics out of what we're seeing. So governors that have been very critical, states that have senators that are Republican with close re-elections, like Colorado, will get bonus supplies because the congressman asked President Trump. Those are things that the military would not play games with. And so it's just the administration balking at the idea.
So the military would allocate it scientifically, for lack of a better term.
Scientifically, and they get it out the door, and they do it in a competent manner, too.
Yeah, okay. Here's another question is it, with a shortage of hospital space, is it practical to reopen Charity Hospital?
No, the environmental damage in Charity is such that it is very hard to do it quickly. We ran into that even with trying to re-stand up the VA, which did not have the damage that Charity had. Yeah. So that's why we stood up the convention center and we're standing up other places. But we were able to get stand up some things in the VA, but primarily we went to convention center and others because we needed to. Old Charity would have taken an enormous amount of money and time.
Oh, okay. Meaning by the time they got it cleaned up, the crisis would have been over, or?
Yeah, you probably would have had to go through and redo HVAC systems and everything else. So it just would not have been feasible.
Yeah. Do you know how occupied the convention center is?
As of today, I do not, but it is not full, which is good news.
Right, yeah.
And the last conversation I had, which was with people who were supplying assistance, and I think CVS set up a pharmacy out there to make sure that we're comprehensive. They said that the demand has not overflown the facility yet.
Yeah, okay. I mean, are we, to the extent that you, and I realize this is not your responsibility, to the extent that you're briefed on the matter, are we now at the point where we feel like we have enough capacity over there?
Well, I will tell you that we feel better.
Okay.
And as of now, I think in the state, we have right at 1,800 hospitalized. We have 332 on ventilators. And so if you look at the day before this report, which will probably be 3 days ago, there was 349 on ventilators. So we came down a few.
Okay.
But, we still have to test and we still have to treat. So we are prepared if we have to go bigger and bolder, that we will.
Okay. I mean, what do you say, one of the things that's changed in the month or so we've had this is the perception that we were going to run out of ventilators. Now we seem to have plenty of ventilators. What happened with that?
It was a good thing that happened.
Okay.
Mayors issued stay-at-home orders, governors followed, and people adhered to them for the most part. But if people didn't stay at home and we didn't do the mayor and the governor and these parish presidents didn't do those very hard things that they're getting criticized for, we would have run out of ventilators. And we hope we're past the point where
it's a threat.
It's a threat, but it's better in this instance to be safe than to be sorry, and it will only go into our ventilator stockpile for if this ever happens again, which this should not have happened the way it happened, but we still have to be prepared.
Yeah, okay. Another question from Ben is, like Lowe's and Home Depot are open and they're selling plants, and yet people are supposed to not go to church. How does that reconcile?
Easy. And I had a call with I think it was 200 pastors, and I didn't mince words.
Okay.
Churches are small. The seats are right next to each other. And so a church does not have the ability for social distancing. And the question becomes, is church in person a essential need or a essential service? Because most churches can go virtually, and we have a number of pastors in the state that are still doing services but virtually, and people could do it by phone, then that was an alternative. But for people to go out and still buy things like from Home Depot, which I use, but I buy my laundry detergent from Home Depot. I buy a lot of essentials from Home Depot because the line's shorter than Walmart, and a lot of people didn't realize that Home Depot and Lowe's sold things like laundry detergent and all of those things. But those places are big, they're airy, and as long as their employees are practicing social distancing, masks, and all those other things, it's safer than people piling in the church and people sitting next to each other on a pew. I mean, it's unfortunate, but it's reality.
What did you get if you had a phone call with 200 pastors? Did any of them argue with you, or what was your
No,
reaction?
the general sense is they're frustrated. But the good news was that this time, unlike Katrina and Rita, we made sure that they were eligible for the Paycheck Protection Program and all the other things from day one, so that they didn't have to go catch up. And so we wanted them to be able to keep their employees on the payroll. If they receive a check from the church, that they would still receive it. And the goal is to make everybody whole and to keep everybody safe. And look, there are a bunch of decisions that are not popular, and we may revisit when this is over. And if they say that, leaving churches open, we would have only had a couple more deaths, then people can argue one way or the other. But right now, when you're trying to do the best you can in an uncertain world, I will not argue with any elected official that erred on the side of caution.
Yeah. David of Baton Rouge says that South Korea did a better job of managing the healthcare crisis, and what does that prove to us? What does that tell you about what we did wrong or what we should be doing now?
Well, South Korea started testing very early. They acknowledged it was a problem immediately. But we need to learn from South Korea because they opened up too soon. And now South Korea is starting to see a surge in cases again. And so I think we should look at places like South Korea. But the first thing they did was acknowledge that it was a problem. Then they went to stay-at-home orders and things like that immediately. Remember, we found out about this as early, first time we heard the president publicly speak about it was January 22nd. And at that point it's not our problem, it's a China problem. Then February 22nd, which was before Mardi Gras, it was, there are only a few cases in the United States. In a week or two, I predict this will be gone. At some point, facts and dealing with what it is as opposed to what you want it to be is important. And I'm not saying that to knock the president. I think we'll have 9/11 style commission to figure out who knew what and when. But had we, in January 22nd, for example, had a stay-home order or a severe warning about gathering in crowds, then we could have ever had the conversation about Mardi Gras and other things. But we had two briefings where the president talked about it before Mardi Gras, and he kept saying that it's not a problem, it's going to go away in 2 weeks. And so we all have to learn, and I think that one of the things we can learn is that the CDC has to step up and be more aggressive if it's a pandemic, and we should be listening to the head of the CDC as opposed to any president, Republican or Democratic. I think the person who runs the CDC is so important. They should be basically like the person who runs the FBI. They are confirmed, and then they have a job for a certain period of time, whether the president likes them or not, because that is a very critical job, and now we see how important it is.
Yeah. But one thing people say in criticism of that idea would be that the head of the CDC is not an economist. their job is to recommend the safest version of protection, regardless of the economy, and that there's some need on the other side of it to push back against that. And if you don't have, and the political process doesn't work, but it's supposed to be designed to do that, having elected representatives in charge of bureaucrats so that elected representatives have to respond to the people and what the people are angry about.
Ideally, that's the case. And I don't want this to appear to be a Trump bashing segment, but we're at a point where we're over 18,000 missed troops from the commander in chief. And so I would prefer the CDC, who is the medical person, to give the medical advice to Congress. And if we decide we want to overrule, then we should vote and we should bear the responsibility. If we decide to put the economy over the health of the American public and we vote to do that, then we should bear the responsibility. But I think that on January 22nd, if the CDC would have said, look, we got a big problem coming, people need to start acting accordingly. If you're coughing, self-isolate. We could have gone with milder remedies had we started acting on the 22nd as opposed to March.
This is from Karen and Metairie. What's your view of the travel restrictions being imposed by Texas on Louisianans, essentially?
You know, I think it's politically convenient for a governor to say, hey, this is not Texas problem. We didn't cause any of our infections. It's all people coming from Louisiana. The Florida governor did the same thing, and then the Florida governor said, oh, it's the people from New York. It's just a very creative way by politicians to pass blame as opposed to standing up. And, you know, at that time, Louisiana did have a number of cases, but the protocols were still there. Check temperature, and there are symptoms that you could look for, but to just pick places and say, you know, when you get to Texas, you have to stay in one spot for 14 days. I don't think it's realistic. I don't think they ever had any intention on enforcing it. But for a politician, it sounded like he was acting very tough to protect his people in Texas.
Okay, Colette of New Orleans asks, what kind of oversight is there going to be over all these loans and grants to businesses?
Well, Treasury will exercise the first line of oversight. And then we set up a select committee in Congress that will oversee the administration, have the ability to issue subpoenas and everything else so that they can track what has happened. I mean, we've spent an enormous amount of money.
In very little time.
And we need to make sure that it was spent right, it was designed for its, used for its designed intent. And so James Clyburn is going to chair that committee, and we're going to exercise our oversight. But I can tell you now, as Homeland Security Committee, where I sit on, I'm sure that Benny Thompson, the chairman, that we will be calling FEMA in to figure out who, what went in there, and how money was spent.
Yeah. Couple of last questions. One is, you were an early endorser of Joe Biden, so I guess you bet on the right horse as things turned out. Tell us about, and it's been difficult for, you know, this isn't a traditional campaign, and also it's just been difficult to get into the spotlight from his position. But what is his, to the extent you've discussed it with him, you know, what is his position on what we should do going forward?
Well, every once in a while he will issue statements about what he thinks we should be doing, which is basically an open letter and advice to the current president. And I believe that it was somewhere in early February, or maybe it was January, he gave a statement saying that the president should not believe China, that we should send our own inspectors in there because China will not tell us the truth about how bad it is, how it spreads, or anything else. We should go do that. And we didn't. And so he continues to offer what he would do if he was president, but he's not offering it as just a I'm different from this president. He's offering it as a person who helped to oversee our response to Ebola, which, by the way, we went to where it was, and we protected the U.S. homeland from significant cases. And I believe you can count on two hands how many cases we had. So he's offering that based on experience. And so I just wish that we were in a better climate where people could actually sit down and listen to people. But campaigning has been difficult, but we raised $47 million last month, and we're looking for a lively debate on who should be the next commander-in-chief, who's better to unify the country, and who's better to lead. And I think that Joe Biden has a good argument.
When the president imposed a travel ban on China, I think Joe Biden said it was xenophobic. Do you agree? Did you agree with that at the time, and do you agree now that it was a bad move?
Well, it was President Trump being President Trump. He implemented a travel ban on China, and then 40,000 people from China came to the United States. To me, it's more evidence of I'm going to say one thing because it riles up my base, and then I'm going to do another. So last night he tweeted out that he's going to stop all immigration to the United States. So now his staff today is scrambling to try to figure out how to do it. Not that he talked to him about it, not that they sat around and decided it would be the best policy and how to implement it, but my experience with him is going to be this idea of stopping all immigration will never come to fruition. He doesn't care if it comes to fruition. It has changed the subject. So now people are talking about immigration as opposed to the lack of testing and all those things of how we reopen government. So no, just China was a bad idea. I mean, it should have been by the time he did act, it was all over the place. And so self-isolation, social distancing, testing, all of those things would have been more important at that time before that. And so remember, he turned down tests from the World Health Organization, saying that we have testing under control. Testing is what would have given us this early indication. We would have been able to stop it a lot earlier. This pain would not be so bad. The carnage would not be so bad. And all of those things go into why I think that his travel ban was misguided, inadequate, and all of those things, because it wasn't accompanied by anything else.
Okay. One last thing I wanted to give you a chance to talk about. When you arrived here, there were maybe a couple of dozen protesters outside, and I think they were from the river parishes, and I think they were protesting chemical plants and pollution. And I don't know if they're still outside. They were louder than they are now if they were outside.
I'm not sure. They are concerned citizens from St. John, accompanied by other environmentalists and concerned citizens from the river parishes. And so there are two studies that are out now. There's a Harvard study out, and there's a Tulane study out that says that long-term exposure to pollutants could enhance or does enhance the likelihood of dying from COVID-19. And so that isn't an alarming study. The Harvard study based theirs over long-term exposure to pollutants, and that was 16 years of exposure. And so they have a real concern. They have schools that are close to plants. They have people that live in these communities. And if you look at the cancer rates and other things, I think that they are right to demand for more studying from both the federal government, but a lot from state and local leaders in terms of where the school is located, in terms of the Dinka plant, which is the biggest concern out there. And so while we're in this pandemic, the Trump administration has loosened up EPA standards and requirements for monitoring and reporting. I think we're on letter number 5 or 6 to the Trump administration on this very issue. We called on Nancy Pelosi to set up a task force on why African Americans are disproportionately infected and dying of COVID, and part of that is to look into all of those other factors. And you have environmental factors, physical factors, economic factors, all of those things. So I believe they're right. They sent us a letter, and I think they just started sending it to other elected officials. And we're going to respond to them. And so, but the fact that they are alarmed and organizing to voice their concern about their air quality after 2 reports, and they've been doing this, but for them to get really organized and louder after 2 reports that connect air pollution with COVID-19 deaths and infection rates is serious, especially after the initial numbers from St. John came in.
Yeah. Okay. Well, we appreciate you coming out here today. You've been a good sport to answer all these questions.
No problem.
And to come through the protest. And stay safe.